the last 5 to 7 years, I've been suffering from issues which I felt required the involvement of a colorectal surgeon. It so happened that, in January this year, I had a severe condition which turned very acute, and I needed to see a doctor urgently. And I was on the lookout of a female doctor, and I was told that there is a female colorectal surgeon right here in Apollo. The very next day I came to Apollo and the good fortune to meet Dr. Shabnam. Dr. Shabnam, she's very cordial. Her passion for medicine is very evident in the way she talks. And she goes to length to explain what the problem is in very layman terms, and which is very comforting for the patient. For the first time, I was able to talk to a doctor about what my real problems were, and I think that was such a big relief for me. And then after that, it was smooth all through, and she suggested that probably a surgical intervention is required. And before that, I had to again go through something called a colonoscopy. And after the results were out, she told me it's not cancer, it's benign, so this is treatable. It was decided that okay, within the next 2 or 3 days, maybe the surgery can be done. What I loved most about my treatment here in Apollo was, the confidence the doctor gave me, because I was really very scared of going through under the knife, and which was one of the reasons why I was delaying going to a doctor. Hospitals like Apollo, where you have opportunities to meet doctors like Dr. Shabnam, there are female doctors, specialists in, I think in every area, every speciality you will find somebody. So, at the earliest opportunity, come and meet a doctor so that you can do your early screenings and be sure that you don't take your ailment too far.
For women out there, I would say that you have a facility now. I'm myself a colorectal surgeon, so I'm a woman. I understand your priorities, your outlook to the whole life, to the family, to the diseases. So many times women think that we are having these symptoms and we don't have somebody to cater to. We don't want to probably go to a male surgeon. If that is the concern, we still have that facility. You can come over, you can get screened, you can have your early detections and all.
Since January, I would say that my lifestyle has been quite good, and my well-being has improved by leaps and bounds. So far, I have had a great experience in Apollo, and I would recommend people to use the services when it is available.